What do you do if you see patients or people hooking up in the ER? You tell them to stop, please. Coming back from the dead, parking lot patients, and how to determine rare, unidentified illnesses in the ER. Get ready to learn because today I am breaking down some of the most thought-provoking questions about the emergency department. All right, let's dive right in. What's the worst smell in the ER? Probably is not related to poop, vomit, or blood. The worst smell is actually rotting dead flesh. And very specifically, I've had cases of Fournier's gangrene, which is bad bacterial infection in the groin area that then I've had individuals have it rupture open where abscess, gas, and air from the bacteria release. And it is just a very, very awful smell. And I feel bad for individuals who have that and they actually need to go to the operating room. And it's a very serious, life-threatening type of infection. Do you get a lunch break at the hospital or do you just eat vending machine food on the go? Great question. So no, ER doctors do not get a lunch break. We do not get any specific allotted time to take a break or take time for food. We just go get it when we see an opportunity to eat. And that's also why I eat super fast. I just inhale my food because I don't know when I might get an opportunity again to eat, or if I'm eating nice and relaxed, what if an emergency comes in and I have to leave and now I have to come back to cold food? I'd rather eat my food hot and quickly. Typically, I actually bring my own meal prepped food into the hospital. Many of my colleagues don't do that. They'll usually either get food from the cafeteria in the hospital or like protein bars or snacks or something like that. Do doctors in the emergency department wear white coats? Seems like they would get dirty with all the blood and stuff. So both, actually. Some individuals in the ER will wear a white coat and some won't. I don't wear a white coat in the emergency department. I'd rather wear a long sleeve shirt underneath my scrubs, or I have a separate jacket that has the same insignia on my chest here on my jacket. That way I can be identified. I don't like the white coat because it's long, it gets in the way. I'd rather not do that. Are EDs allowed to hold you against your will, even if you come in for non-mental health related injury, say? Maybe like you are in a lot of pain and say you want to end it, but don't really. So yes, emergency departments are able to and legally allowed to hold people against their will under certain circumstances. In the state of California, something called the 5150. We do an emergency 24-hour hold, which then allows that individual to be evaluated by what we call a psychiatric emergency team. Have you ever treated someone in the parking lot of your hospital? Yes, but not normally. Typically, if there's an emergency that happens in the parking lot is still like not the emergency department, so they actually need to be brought in. I've worked at facilities where you have to call 911 even though you're right there, or I've worked at other facilities where staff members go out and bring the individual in. Going outside the ER, you don't have your equipment, you don't have your monitors, you don't have your medicine, so it's not as advantageous to go out there. It's better to bring the individual into the emergency department anyway, logistically wise, but there are some legal ramifications, and that is also why doctors don't go out there. Is Lazarus Syndrome a real thing? So Lazarus Syndrome is basically when somebody is like pronounced dead and then brought back to life. Yes, that could happen. In my career, have I ever seen it happen? I've seen it only once, but it was related to somebody actually having a defibrillator in their chest connected to their heart. And even though they were pronounced dead, it had given a heartbeat just for a very short period of time. What do you do if you see patients or people hooking up in the ER?
I'm gonna turn you around and take you from the back.
You tell them to stop, please, inappropriate location, or you potentially ask them to leave.
Get out!
If they don't have a medical reason to be there. Typically, once an individual is caught, they usually stop, but yes, totally inappropriate. I've seen it once in my life, heard many stories. The emergency department is, an area where a lot of people come in when they're sick. It's clean, but you just don't know sometimes, and totally uncalled for, inappropriate. Please don't do that. Worked in patient transfer a few years ago. Got some horror stories and some wholesome ones. What's some of your wholesome emergency room experiences? Obviously, some of the best experiences is saving somebody's life or providing care for an individual when they're in so much pain and then they're so grateful that you relieve their pain. Some of the best things that we do see is when people make miraculous recoveries and they come back to the emergency department and they say hi and thank you for whatever it was that you did for them. That's pretty good feeling for doctors and staff members to be like, okay, what I'm actually doing means something. What's the procedure for handling rare or unidentified illnesses that come through the ER doors? So great question. Our job in the emergency department is to stop the emergency, okay? Take care of the emergency. Things have changed and now we see a lot more medical issues relating to chronic medical issues, chronic pain. But yes, we get moments where you get these unique and rare illnesses and diagnoses that come through the emergency department, and you may not be able to get it right away. But the job of the emergency department is to start very broad and narrow down what it could be. You're doing emergent tests and studies that can get done very quickly, knocking off the most serious things at the same time of trying to figure out what it could be. And if you don't get the answer, but you know that somebody is very sick, you can admit them to the hospital and get continued workup done. What does a doctor do if they lose a patient and have to report it to loved ones? How do you handle that? So yes, that's something we have to do. You kind of get taught in medical school and residency how to approach the situation and best ways to approach it. Everybody has their own way of going about it, but it's never easy. It's difficult, it's emotional, even for the doctor. Even though we have like not an emotional tie to that individual, but we have an emotion of being a human, and so it's difficult no matter what. Can a specialist refuse care on a patient even though they were on call? What do you do in those circumstances?
Or something.
Oh no, oh no, no.
So yes, sometimes we have on-call specialists for different specialties, surgery, urology, nephrology. What ends up happening is sometimes the case, either the hospital can't take that case into the operating room, or that it's a procedure that needs to be done that's like a sub-specialty of that specialty. So the doctor maybe doesn't have the skill to be able to do it, or is not credentialed. So then what happens is you look for a higher level of care facility. So in every major city, there's multiple different hospitals, and typically there's always one that has every single specialty available, and you can contact them and say, hey, this is a case that I have. And typically it's almost by law that they have to accept the individual if they have beds in that service. How do you deal with cases of suspected child abuse in the emergency department? Okay, that's a good question. That's a heavy question. We always have questions that we ask. Typically, the nursing staff has a very routine question that they ask every single person about domestic violence and safety at home, these sorts of things. As physicians, we look at patterns of injuries, and if we have a high suspicion, then we actually contact Child Protective Services to open up a case to investigate. If you are in any sort of abusive relationship that is not normal, definitely try to get help. If you ever felt like the individual won't let you be by yourself, you're allowed to be by yourself, and you can have us to ask the individuals to step out. Then you have time to share what you need to share with individuals in a safe setting. Can you clear up some confusion? When should someone go to the emergency department versus urgent care? Yes, this is a good topic to talk about. I actually have made a full-length video literally about the differences of the emergency department versus urgent care. So if you want to check that out, I will put it in the description. In general, there are a lot of different reasons why one would go to urgent care versus the emergency department and vice versa. But a good example would be pink eye versus no eye. Pink eye typically is caused by a virus, and that can be treated very simply by going to the urgent care, versus if you have a traumatic eye loss or an open globe, meaning that there's an injury to the eye where the fluid is leaking out of your eye, that's an emergency and that needs to go to the emergency department. Do you do RSI, rapid sequence induction, in the ER? Rapid sequence induction is what we do when we intubate somebody. So we don't have individuals that are NPO, meaning like they haven't eaten food for 8 hours like you would before you're going into surgery. So we have this procedure where it's rapid sequence induction, where we give a sedative followed very fastly by a paralytic medication. So the sedative knocks you out, and then the paralytic obviously paralyzes your body. So that way we could intubate somebody. What if your patient is too big or heavy for a gurney or some x-ray machines? What would you do in that case? Some individuals, unfortunately, their body habitus prevents a lot of things from happening. So hospital beds, there are larger hospital beds that are available. And then staff members that have to move individuals, they actually have something called the Hoyer lift, or different types of lifts. So that way individuals don't actually injure themselves trying to help lift an individual. These are great questions. I love answering questions, especially about the emergency department, because it's what I do for a living. If you guys have continued questions, let me know. Leave them in the comments below. Also, check out my new supplement company called Life Happens. And do me a favor, subscribe, turn your bell notifications on, and hit that like button for me. Thank you so much for watching, and stay healthy, my friends.